Hi, so I'm here with Leanne Winder, who is a kinesiologist, but also a midwife. And for this issue of Kinesio Geek magazine, I really wanted to talk to people who were experts in the idea of taking care of women as they're working through this big time in their life. So we're going to chat a little bit today about prenatal care and about working with babies in utero and whatever other wonderful things that happen upon this conversation. So Leanne, thank you so much for talking to me.
Thank you.
I'm wondering, to start, can you just tell us a little bit about your background and how you ended up in the holistic health field?
Okay, so I started nursing in 1981. So I was 19 and always wanted to be a nurse from being a child. So I did nursing. I did midwifery in 92. And then from then on, I basically just stayed in the midwifery field, working in across all areas, delivery suite, antenatal, postnatal. I taught antenatal classes for 10 years. I worked in like an IVF clinic. I worked in a well women's clinic. And in more recent years, I worked in a clinic with a gynecologist as well. Whilst as a midwife, I got interested in Reiki. So I did a Reiki course, and then I would use Reiki on my ladies when they were laboring or upset babies, that sort of thing. And then I was introduced to essential oils by a colleague and studied clinical aromatherapy so that I could incorporate that into my work, particularly in the delivery room. So, we'd have nice oils burning, etc. Probably, I couldn't even tell you when, in around the year 2000, I took my daughter to see a kinesiologist because she had alopecia. She was 8 years old, and a friend had recommended a kinesiologist. I didn't even know what it was. I'd never heard of it, but I just thought this is worth a try. We'd been down the medical path to no avail. And within 3 weeks, those bald patches on her head started growing back. So I just thought there is something here and started seeing a kinesiologist myself. I studied touch for health just out of interest. And I didn't do anything with it when I studied it, but it was the knowledge base that I had. I then became a middle manager in a hospital and got my diploma of business to do that. And then I started to feel like I needed to do something else. I needed to change. The hospital system wasn't the same as it was when I first started. And it was more of a business, whereas when I started, it was very, very patient focused. And I started to feel really unsettled about that. And so I signed up to go on a retreat to Bali for women, and something I'd never done before. I went on my own. I was with women from all over the world, including Canada, England, New Zealand, as well as Australia. And it was on that retreat that I saw a Balian, a medicine man. And the day before I saw him, it just popped into my head that kinesiology was what I needed to do. And when I saw him, he confirmed it. And so when I came home from Bali, I researched, started studying 2 weeks later. And so that is how I got into kinesiology. And so I did my certificate 4, went on to my diploma, my international diploma, and I've been working in that field ever since. So I stepped back from my role as a manager and just went on to casual midwifery work so that I could balance the both together. So that's really the story of how I got here.
There are so many people in our field, though, that got here because of exactly what you're saying. They have a child or someone they love that gets a diagnosis. Medical system doesn't seem to do anything with it. somebody refers them to this weird thing over here.
Yes.
And you fall in love, right?
Yeah, I know. It's interesting, isn't it? Because I just also found when I was studying, I was still working full-time as a manager. So I was juggling both. And so I would go like 2 weeks without a day off because I was at school and all the rest of it. But I was I felt like I couldn't tell my colleagues because Western medicine's so evidence-based. I was fearful of how they would see me, knowing that I was doing this thing that was considered alternative. My staff knew that I was doing it and they were fully supportive, but the people on the same management level as myself, I found it difficult to let them know what I was doing and have them accept it. Yeah, it was a difficult time, but still I persisted because I knew that was where I needed to be.
Cool. Okay, so once you had gone through all of that then, how have you found that muscle testing and this kind of energy work have complemented your midwifery practice?
So working as a midwife, it's not easy to combine the two together in a upfront way. So I can't, for example, it's deemed as a conflict of interest, and because the Western medicine doesn't deem it as evidence-based, I can't muscle test women when I'm working with them in a hospital environment. However, I can draw on my own intuition and my own experience and muscle test on their behalf without necessarily them having an awareness of it. When it comes to what does this woman require, what is best to suit her needs, etc. Working as a kinesiologist and having women come to me who are pregnant, I can just go all out because they're there for that. So there's a difference. There's quite a difference there, if that makes sense.
Right. It's like, are you in your role as a midwife or are you in your role as a practitioner seeing pregnant
Exactly.
women? Gotcha.
Exactly. Yes.
Okay. But I did notice on your website before we began talking that you do offer sort of packages for like helping women throughout this whole process. So what does your average session with a pregnant woman look like?
Okay, so I see women in all stages. So I do see women who are in the prenatal stage. So women who have fertility issues are really more the ones that I see. And it's usually around, so for those women, there are blocks to why they are not getting pregnant. And so where I address those blocks. So they might come to me and say, look, I'm on my second or third round of IVF. I'm not able to get pregnant. I don't know what this is about. They're telling me that there's no reason for me medically or my partner medically. And so we look at the emotional stuff. And I guess the things that I look at are like, I don't necessarily have to ask it up front because it will come up in the session, but it might be around previous sexual abuse is a reason why they may not be willing to go down that path on an unconscious level. A miscarriage history or a birth history or birth trauma they've experienced sets up like a self-sabotage type of environment where, subconsciously they're thinking, I can't do this again, so they don't. And for some women, it can be just the fact that they've had a poor parenting experiences as a child themselves, and there might be fear for them around, what if I'm like that? How can I be a good mother to a child when I didn't have a good example myself? Do you know what I mean? So there's the sorts of things that will come up for a woman who is having fertility issues or wanting to get pregnant and finding it difficult. Even something like, I had a client who was having fertility issues and it came up through the session, whatever the emotion was that came up for her, I said the word and then she started crying and she said it's my fault. And because she'd had quite a few sexual partners before she met the partner she wanted to have a family with, and she'd had terminations, she felt like she didn't deserve to have a child. So it's, I mean, there's lots of reasons, but in a kinesiology session, as you know, we're muscle testing and we're looking at what are the emotional blocks around this and what do we need to do to clear it, and so that's what we do in the session. Yeah, does that make sense for the prenatal?
Of course, yeah.
Yeah. And someone who comes to me antenatally, I mean, there's a whole gamut. It's physical, it's emotional, it's nutritional, you know, all of those reasons. So usually when someone comes to see me, they have an idea of why they're there and what they want to address. And, you know, it might be things around the fear of things that happen in labour. So, you know, am I going to get the support I need? Is the pain going to be too much for me? What if I tear? What if I use my bowels? I'm so scared if I use my bowels when I'm delivering my baby. You know, it's things like that. It's things about, am I going to have some type of, am I going to be able to have intimacy after, like, or are there going to be issues that stop that? Am I going to be a good mother? So there's all those emotional, the fears and worries about labour and after, but sometimes it's the things that are occurring during the pregnancy, like pelvic instability or backache or indigestion, those sorts of things. So people will either, I find I get the girls who want to be the best mother they can be, and so we work on parenting issues. Fears around the labour, it could be working on those, and for other girls it's the pelvic instability or the pain that they currently have. So as an example, a client I had, it came up to work with the individual muscles of the pelvis and what emotions were blocking them. And she had lower back pain and was finding it difficult to sit, to walk very far, etc. And once we cleared out those emotional blocks, those things weren't such an issue for her anymore. So like, it just covers a huge range of topics. And I also try and look at the nutritional aspect as well. So, you know, is this woman, is she getting enough iron in her diet? Because, you know, iron is, your blood supply increases by up to 30% in the first trimester to try and get all that extra oxygen to that child that you're supporting. So you're supporting yourself with oxygen, but also a baby. Babies start to draw on your iron stores at around 28 to 30 weeks. So often those girls will be having blood tests around that time just to monitor the iron. So if you can get on a good iron supplement prior to all that, you're well supported. Folate is important prenatally because that's been shown to reduce neural tube defects. Vitamin D for immune support and mood balancing, magnesium for to help keep you, you know, calm and stable, but it's also good for your muscles and your cells, and helps with the absorption of vitamin D. And probiotics are extremely important. We want good gut health in mum, because when baby is birthed, if baby's being birthed vaginally, they pick up all that beautiful positive bacteria on their way out. And for the girls who have cesareans, it's becoming common practice to seed the baby. So they'll do a vaginal swab at the time of delivery and then place that over the child to see to the baby's getting the good bacteria from mum. Even with a class as a sterile cesarean section. So there's lots of things to address with the pregnant girls as well.
I didn't know they were doing that with the swabs now. That's really
Yeah, yeah.
interesting.
Yeah, so it's called seeding because they're actually, well, they're placing the seeds of bacteria on the child. So a lot of obstetricians here are doing that as an automatic to help the baby to develop its immune system. And of course, you know, if you're breastfeeding, the probiotics are passed through the breast milk as well.
Right.
Mm, mm.
Okay. I mean, out of curiosity, and I know this wasn't something we had talked about before, so it's okay if you don't have an
Yeah,
answer for it.
yeah,
But
yeah.
do you ever use the mother to surrogate for the baby in utero?
Uh, yes, I do.
Okay.
And sometimes it just comes up through the session. Well, surrogation will come up and then we'll work out it's, yeah, surrogating for baby. So I don't know. It depends on your views of things. I read a book a few years ago called The Cosmic Cradle. I don't know if you've heard of it, but it was written by two scientists, I'm pretty sure they were American, and they liaised with a Japanese scientist, and was written about people's memories of before they came here. And reading that talked about how some people's memories were choosing who their parents would be, remembering what it felt like in utero, etc. So when surrogating for, when a baby, it comes up that we need to work on baby surrogating through mum, like to me, it makes total sense because that is a little being. So it's not always easy to translate that to a pregnant woman. It can be challenging. Yeah. And I just have to, I guess, when I explain kinesiology, when someone comes in, I actually just say to them, I'm just working as the interpreter. I'm just telling you what your body is trying to tell you and you're not understanding. And so even if it doesn't make sense to me, hopefully it makes sense to you. And, you know, I just sort of leave it at that. So most women are accepting when something like that comes up, because
Yeah.
they feel so connected to their child that it makes sense to them.
I ask because when I'm working with a few pregnant women right now, and it's one of my favorite things to do in our work. And I find that usually they want me to do some kind of check-in for the baby, right?
Yes, yes.
And a lot of the women, you know, like you, a lot of the women that I see, I'm seeing because they've had problems, they've had miscarriages, or they have issues in their own history that are making them a little concerned about going through all of this. So, you know, they're always wanting to check in and see where baby's at. And I'm often muscle testing the same way that I would for the mom, just looking for stress, right, on this little
Yes,
being. But
yes.
I always find it really fascinating, especially for me, it's especially as we're kind of nearing the end of the pregnancy, you start to feel more of the personality of this little being.
Yes.
You get a little bit of attitude sometimes when you're like interfering. Yeah, I really enjoy
It's
that.
so lovely.
Mhm.
Yeah. And I think that's why I decided to offer a pregnancy package, because things change throughout. Initially, she might come saying, you know, like I'm worried about labor. And then as they progress through the pregnancy, it's more the physical concerns that they have about how they're feeling. And then as we start moving toward the end, it becomes in what am I going to be like as a parent? And then the baby things come in as well. So I find that if we can try and do 4 sessions within a pregnancy, that we tend to cover as things are evolving, those things are the things that are coming up, so that we've covered the full ground, you know, of pregnancy, labor, parenting.
Okay. Well, then I think my other question would be, is there anything that you wish more people knew about working with pregnant women, or that you would love to be able to teach more practitioners about working with pregnant women?
Um, I guess I didn't really think too much into this one. I think it's probably more an awareness of, I feel like as a midwife and not a kinesiologist, that midwives need to have more of an awareness of the baby rather than just the woman and her partner. But as a kinesiologist, I think we sort of cover all of that, though I feel like the awareness of child is less than the focus on the mother. It's not to the extent that a midwife doesn't necessarily view the baby as much as they view the mother. I know a kinesiologist covers all bases, but I feel like kinesiologists are perhaps less likely to say, today we're going to check in on baby and do a balance on baby. It tends to be more woman focused. So I guess if there was more awareness out there that this baby that is growing within is an entity within itself and is not, even though connected to mum, it's still an individual in its own right, and that child comes with its own little fears and ways of being as well, especially as you know, the baby's floating in amniotic fluid. It's water carries vibration 4 times faster than air does. So, you know, it's classed as an old wives' tale that, you know, like people will say to a pregnant woman, oh, don't get too stressed because your baby will pick up on it. Like, there's a truth to that. There's an absolute truth to that. So particularly if there's been, you know, maybe there's been a death in the family, or there's been a major trauma in that mum's life, or a crisis, or a major stress, a car accident or something, that child feels all of that. And if it isn't managed, it can imprint on the child. So if your client is a woman who has got high anxiety and is fearful of being a mother, for example, then that child's going to pick up on that, and that's going to be an anxious little baby as well. And then, you know, maybe it's going to be a child who's very unsettled, and then that woman's going to be questioning, am I a good mother or not, etc. So if we can nip those sorts of things in the bud early on, we're helping both mum and baby in the future. Does that make sense?
Oh yeah, I was part of the Novative collaborative workshop this last year, and so there were 4 of us that all presented a different part, and it was on epigenetics. And so I was talking about the emotions of epigenetics, and so it's all transgenerational trauma, and then what comes down, you know, in utero is a huge part of that, right?
Yes, exactly.
You're saying it's that some people think it's an old wives' tale, but I don't know how anyone could possibly go, oh well, a mother's providing nutrients through her blood for the baby, and not understand that the chemistry that's in the blood, which is my emotional state, of course that's in there too, right?
Yes, exactly. Yeah, but people who don't have a knowledge of the metaphysical world or kinesiology would just view that as an old wives' tale without thinking anything further into it, wouldn't they? So I guess it's a good example of how there's truth in some of these things that we've been told through our generations, and they come from a place of knowledge way back when. You know, some herbalist in the 16th century might have said it, and you know, where else everyone says it now. I don't know. Do you get what I'm saying? There's truth in basis.
Yeah. Wonderful. Okay. So then, are there any resources? You mentioned the book about the Cosmic Cradle earlier.
Yeah.
Any resources, you know, books, podcasts, classes, whatever that you would recommend for people who wanted to learn more about working with moms and babies in this way?
Yeah. So in Australia, we have a podcast called Australian Birth Stories. And I'm sure that that would be something there'd be similar in other countries too, but they're interviews of women's birth experiences. And so, you know, there's twin births, posterior deliveries, cesareans, a multitude of women sharing their experiences. So if you're someone who is carrying a breech baby, for example, you might listen to a story of someone who's had a breech baby and perhaps a breech delivery, or what things were done to help with this baby who was breech, to help them turn, for example. So that's a really great podcast. There's a hypnobirth or calm birth classes. No, I'm assuming that these types of classes are worldwide, but I know hypnobirthing classes. It's interesting because my daughter did hypnobirthing classes, and when she gave me a book to read about it, and the hypnobirthing, they're talking about it's meditating, get yourself into a meditative state to be able to manage through contractions, etc. But it was all, I laugh, but it was all using colour. And I just turned around to my daughter. So they're talking about rainbow. I said to my daughter, they're talking about your chakras. So it was all chakra colours, that's what they're meditating on. So they're not actually saying to them, these are your chakras, we're balancing to help you through this, but that's basically what it was. So hypnobirth or calm birth. There's also on YouTube, there's a free, now where did I write this down? Sorry, I'm sure I wrote it down somewhere. Oh, and I don't think I did. I'll have to find it. There's on YouTube, there is there are free antenatal classes and pelvic floor support classes. It's a free thing that anyone can watch. I did have a client who said she did the antenatal classes on that were for free, and she said that was a thing that for her gave her all the information she needed. So I'll have to get back to you on what that's called. Also, as an aromatherapist, I would highly recommend oils to use in labour. All oils have their own emotional component. So I've actually got a list that I've made of oils that are suitable in labour. And so when I do my package with the pregnant girls having sessions, I also include a massage oil that I make up for the woman using some of those oils. So if you can get a carrier oil and add the oils that will be of benefit in labour, that's a great thing to use as well. And you can find that information on just by Googling. You don't have to buy special books or anything like that, but you just need to make sure that they are safe to use, because what's safe in labour isn't always safe in pregnancy. So you need to be able to use your discernment about what you're using. So that's really helpful. What else? Perineal massage. If you're aiming for a vaginal delivery, perineal massage is really important in that last trimester, to start working with oils on the perineum to help the perineum. Just basically you're stretching it up yourself. So when the time comes, it's not going to be something that you're going to go, oh my God, what the hell is this burning pain I'm feeling? It's something you'll have a knowledge and awareness of, that this is baby crowning and it's going to be okay. But it's also giving the perineum it's exercises to strengthen so that it's capable of doing it, basically. So that's really important as well. If you can find a nutritionist, might be worthwhile looking into if you feel like your diet needs a bit of support. Unfortunately, a lot of Western medicine with obstetricians and midwives in hospitals don't really look at those sorts of things. They might put you on some iron, but not any other nutritional support, and they may not necessarily look at your diet and what you're eating. So if you can find some really good nutritional support, someone who can support you in that, that can be really good. We've got a girl here who is a kinesiologist and a nutritionist as well, Jo, and her website is flownutritionist.com.au. She's really good with being able to test up exactly what you need, though as kinesiologists we can do that too, but because being a nutritionist was her first career and she's incorporated that into her kinesiology, she's really able to delve in deep about what's necessary for you. Also, if you've got a lot of trauma, if you've had trauma in your life, sexual abuse or parental trauma, it might be worthwhile finding a kinesiologist who does work with trauma therapy or timeline therapy to help you manage through that, so that those things aren't triggers for you anymore. We've got a kinesiologist here in Melbourne who works really well with that. That's Dee Phillips Kinesiology. She works really well with that as well. I'm sure there are similar in other areas of the world as well. So yeah, they're just a few of the things that I would recommend.
Wonderful. Thank you so much.
You're welcome.
Thanks for sharing all of the resources and ideas. And I'll get you to send me your information later so that when we put this up on YouTube and everything, there'll also be links and everything for your website so that people can find you if they have questions.
Yeah, that would be great. That would be great. I'll also send you, like I've just written do you want the format of the things that we look at through each stage of pregnancy? Prenatal, antenatal, postnatal, and perhaps, you know, if there's someone out there who has issues with any of these things, they can straight away go, oh, well, I know a kinesiologist can address this for me. So I'll send you that as well.
Thank you so much.
Thank you. It was lovely chatting to you.